Yang apa ni cakap tadi, nama saya Dr. Ahmad Ritaudin bin Muhammad. So saya bekerja di Hospital Kuala Lumpur, just down the road. I'm a pediatric neurologist. I'd like to thank Dr. Ishaq for inviting me lah. This is the first time I'm involved in such a program, and I feel you guys are quite lucky lah. Somebody has put up a program such as this for you guys. I remember masa housemanship dulu, we never had such a thing. Pergi terus start aja, and didn't know what to expect. So this is a good program, and hopefully you'll gain something out of it. So the slides are by Dr. Hussain. Dr. Hussain, he was the head of pediatrics for many years. In fact, he's probably the longest serving head of department for pediatrics. He retired last year, and now he's working in Hospital Pulau Pinang. So he's put together all this, and I'll just add a few at the end, some of the points yang I think might be useful for you lah. So you all I understand are from various universities, various qualifications, but and you've had a few sessions already, kan? Mana yang tu? Yeah, okay. So pediatric ni it can be quite frightening juga pada mulanya, especially if it's your first posting. You're dealing with young children. Ni nak masukkan granula dalam orang besar pun susah, kan? Duk ketar-ketar, ini nak masukkan granula in a baby, in a newborn. So it can be quite frightening. But actually it's not too bad. With a bit of training and all that, most of the time you can do it quite easily. So we'll go through some of these slides first, and then at the end we'll have a bit more Q&A and that kind of thing lah. So introduction, apa dia pediatrics? There are various definitions, and sometimes different hospitals will have different criteria. There are hospitals who still consider pediatrics, especially inpatients, is newborn babies up to 12 years old. So you will find many hospitals, especially outside KL, yang kalau you're 13-year-old, if you're ill, you get admitted to the adult ward, not the pediatric ward. But here in HKL, we try and our limit is 18 years. So usually those under 18 will be admitted to our ward, pediatric ward. Tapi kadang-kadang still ada juga yang masuk ke dalam adult ward. Overseas pun banyak differences, but I think majority now consider 18 years as a cutoff. So most children or most patients under 18 still get admitted to pediatric ward. In places where they are lucky enough to have adolescent wards, so then these children between the ages of 12 to 18 ataupun kadang-kadang 14 to 18 get admitted to the adolescent ward. And now kita in the Ministry of Malaysia, we are trying to get dedicated pediatric wards in at least some of the hospitals, and I think 1 or 2 hospitals dah ada dah. Setidak-tidaknya pun they try and at least have a special area in the ward for adolescents. Sebab it's different, you know, the adolescent age group ni memang, I know you guys went through it as well. The special age group, you're not quite sure what you are. Budak-budak pun bukan, adults pun bukan, tapi you know, you don't want to be associated with small kids yang ada meleleh hingos apa semua ni, kan. And they have different spectrum of problems. Dia bukan ada, you know, they don't get admitted for demam batuk sesama dan sebagainya, and and it can be a bit difficult for them to cope with apa ni. Kadang-kadang ada yang dah bermisai berjanggut dah apa ni kan, besar, dan mak bapak datang tengok, budak ni dah besarnya. Ataupun kalau ada masalah, one of the problems that patients sometimes can be admitted is if they have obesity, kan. So either they undergo a program to try and reduce your weight, ataupun sometimes when they are obese, they have problems with sleep apnea, sleep obstruction, and they need to be on a BiPAP machine and all that lah. So, mothers of all these, and pet carers of other children macam-macam komen kan. So it can be quite difficult for them lah. But most hospitals do not have dedicated adolescent wards, so they still campur je. Outpatients, most places consider 18 years as the cutoff point. But you will notice nanti when you practice, sometimes we see a lot of chronically ill patients who require follow-up for a long time. I'm a pediatric neurologist, so we see a lot of patients with epilepsy, sawan. And some of these patients continue to have seizures even, as they go beyond 18 years of age. And kadang-kadang, once they have been with pediatrics for a long time, they don't want to go to the adult side. I have patients who are, almost 30 years old. Tak nak pergi lagi. We tried sending them, and then they come back to us and, "Doktor, tolonglah. Saya nak tengok tahun sekali saja, but I don't mind coming here, I don't mind sitting by, these young children. I prefer to come here." Because pediatrician ni dia lain sikit lah daripada adult ni. No offense Dr. Isa, the adult physicians are all very good, tapi yalah kita macam layan macam budak-budak sikit. Maybe that's why they like us. So the posting of pediatrics is usually divided into two big sections. One is neonatology. These are looking at small babies, newborns and all that. And macam kalau kita, because we are a tertiary center, we see quite a lot of premature babies. Babies who are born, prematurely. And the age of, ataupun the size whereby they survive nowadays, makin kecil. Kalau dulu less than 1 kilo, so the chances of survival is quite low, quite slim. But now even 700 grammars, 600 grammars can survive without much problems, with good care lah. And then the next big rotation is your general pediatrics for 2.5 months. So biasanya rotation kita ni 4 bulan kan. So lebih sikit general pediatrics. Sometimes you get rotated into pediatric surgery, but that's not mandatory. So what are you expected to know at the end of it? Basically, what we want to see is you have reached a level where what you say to us is the correct thing. We can trust you. Sebab nanti, once you finish all your houseman, your rotation and all that, a lot of you will be the first line. Sama ada you'll be working in ED ke, you'll be working somewhere in clinic ke, and you'll be the first people to see patients. And we want to be able to trust what you say. Sebab kalau you kata, patient macam ni, then we say, okay, never mind, get an appointment in next week ke, next month ke apa ke. So, tapi kalau if the impression that we get is somebody yang maybe not so ill ataupun doesn't require urgent medical attention, padahal the child needs it, then you'll be in trouble lah. The child will be in trouble lah. So that's one of the most important things that we hope you will pick up. Recognizing which patients are ill and require help, require immediate care. And basically, knowing where your limits are, knowing when to call for help. As a housemanship ni memang is a time yang actually can be quite stressful lah. Masa tu baru you nak belajar all the system, which forms to fill, which bottles nak apa ni, lepas tu macam mana nak present, nak tahu doktor ni macam mana style dia, doktor ni macam mana style dia. And you'll meet a lot of different characters. Ada MOs yang will be very helpful and really guide you and show you what things to do. Others may be a bit more abrupt and expect you to do a bit more. So sometimes it's quite common for you to feel helpless, sometimes useless, sometimes not needed in and therefore kadang-kadang you nak cuba manage things dulu kan sebelum you call for help. But you must always put the patient punya interest first and foremost. Doesn't matter kalau katalah you not happy with this patient, walaupun you tak do a full examination lagi ke apa, walaupun you baru tengok sekejap saja, this patient is not right, I need help, just call orang-orang atas you, and it's much better to alert people and get help early rather than try and manage things yourself. So that's one of the things that we hope you will gain from your posting with us. So if we don't get that sense, if you think, you still can't pick up patients who are dehydrated, patients yang perhaps unwell, septic apa ke, you may be extended. Not as a punishment. You shouldn't see extension as punishments. You should see it as an opportunity for you to train a bit more. Because seriously, it's a good time to learn. Because lepas tu you may not get opportunities to do pediatrics again, and you might get posted somewhere yang tak ada a lot of pediatric punya specialists and things like that. Now, with medicine, with pediatrics, with all medical field actually, as you all have always heard in your medical school, history is very important. A lot of diagnosis depends on good history. And the difference with pediatrics is, budak tu won't come and tell you what their problems are, and a lot of the symptoms in pediatrics is rather non-specific. Usually not feeding well, ataupun not thriving very well, ataupun irritable. So you have to try and tease out from the history what's going on with this child, and that's where the difference comes. You need to try and get it from their parents, and that can be quite challenging sometimes. In addition to the standard medical history, yang differentiates pediatric punya history taking from others is you must take a good birth history, what happens during birth and all that, a developmental history, so you need to know all your big developmental milestones, macam rolling over at what age, crawling at what age, standing at what age, speaking at what age, just the big ones. Immunization history is important. You must hafal you punya itu, and you should arm yourself with points to fight against all these anti-vaxxers ni. And dietary history is also important. Then when it comes to physical examination, examining pediatrics ni memang is completely different from examining an adult. Okay, you don't start by looking at the hands, feeling for the pulse, going up, looking at the JVP, kalau cardiac lah, kalau cardiovascular examination, lepas tu palpating the precordium. So biasanya it's opportunistic. So you will get most information when the child is quiet. sebelum dia menangis lah. Because once the baby starts crying atau the child starts crying or he runs around and all that, it gets a bit more difficult. Therefore, it's very important for you to get as much information from observation. Observe dulu, jangan kacau. And if the baby is with his or her carer, with mom or dad, biar aja dulu. And tengok how they are interacting with the child, with their parents, apa semua. So to just give an example, say there's a 3-year-old with an underlying asthma who's come in with shortness of breath and wheezing lah. Mak dia kata, came to ED. And now, so one of the things when you're faced with somebody with asthma, you nak grade dia punya severity, kan? You nak tahu, is this a mild exacerbation? Is this a moderate exacerbation? Is this a severe exacerbation? Nak tahu tu, you don't immediately need to handle the baby, put on pulse oximeter, buka dengar dia ada rongkai ke tak. No. You can just by observing dia dulu pun you tahu. You know, somebody with an asthma attack but still okay, nampak dia interacting okay dengan dia punya parents, still feeding okay, probably will just have, you know, mild exacerbation. As compared to somebody who's irritable, menangis saja, tak nak bercakap, unconsolable, you know, that's the sign that, you know, it's probably a bigger problem, probably moderate or severe. And then just by looking pun you can even without taking off dia punya baju, you can see, you know, maybe nasal flaring, maybe you can see the use of accessory muscles. You can, you know, hopefully you won't see cyanosis because then itu dah quite a late sign. But, you know, observation is very important. If you need then to auscultate, which you sometimes need to do, try and auscultate masa dia quiet. So in fact, you don't go through the usual percussion, palpation, lepas tu buat auscultation. If the baby is quiet, you auscultate dulu. Terbalik pun tak apa, because that's when the time where you can listen. So that is what is meant by opportunistic rather than systematic. That's true for all other symptoms juga lah, neurology ke apa ke. Yeah, and that's the point again. Auscultation often not possible, as a child may start crying when handled. And you know, if they're crying, you try and help the mom to calm the baby lah. Jangan, because when parents bring their children, parents are also stressed. So you jangan kata, cepat diamkan baby ke apa ke, cuba bagi makan. You try and sit there and help them. Usap-usap sikit baby ke, or suggest them to do something, you know. So because the parents also usually will be tired, maybe the child dah tak sihat 2-3 hari, dah tak cukup tidur, dia punya kerja pun terganggu apa semua. So parents are also stressed. So you must recognize that. The fact that they have brought your child to you, maknanya, you know, they need help. No problem. So look at the baby and also look at the parents and try and understand. Jangan cepat sangat naik angin kalau parents are a bit abrupt. Kalau, you know, diorang bad mood ke apa ke, that's understandable. I'm sure when you have children, kalau belum ada lagi, when you have children nanti you'll understand it's not easy to care for a sick kid. There are more specific examples of examinations yang you do in children and not in adults are things like your neurological examination. You can't ask the child, tengok kanan, tengok kiri, tengok atas, tengok bawah. You have to observe again. Contoh kalau you nak do examine the eye movements. So babies especially, they have very good, once they are at least 2-3 months of old, they have very good facial recognition kan. So you move lah and see whether the baby follows your face ataupun tidak. That way you can see the cranial nerves. And then you look at how the baby feed. and that indirectly you can assess dia punya facial nerve function, dia punya cranial nerves 9, 10 and 12 punya function. Okay. Sometimes you don't even need to touch the child during the examination. Other important things about pediatric examination, you must always chart dia punya height and weight and head circumference. So you will see kita punya outpatient clinics, usually they'll have a stamp, ada date. Bawah date tu mesti akan ada weight, height, head circumference. Because one of the best indicators that a child is not, dia punya illness is not well controlled ke, ataupun dia ada something not going right, is poor growth. So always remember, and that all babies should have their baby card. Always ask for that, and whenever we see them, always update dia punya baby card. In particular, dia punya growth chart. A normal pattern of growth excludes many chronic conditions. The normal range for all the vital parameters are obviously going to be different from adults. In the beginning, it's going to be difficult for you to memorize everything, but if you know where to look, at least you should know where to look for normal ranges. And at the end, there's the pediatric protocol book too. I'll show the website, the link at the end. You can download it from the Malaysian Paediatric Association punya website. And it should be your best friend lah, the pediatric protocol book, because in there it's been written very, very well. It's now in its 3rd edition. It's got all the common pediatric problems. It also has all these normal values in it. So you should at least know the normal ranges for respiratory rate, for example, blood pressure, all the big numbers. We try not to prick children if we can, but sometimes it can't be helped. Especially nowadays, dalam zaman dengue is endemic and all that. Sometimes we do need to monitor bloods very frequently, but we try not to, and keep the blood taking to the minimum. So if somebody comes in with a typical history of febrile seizures, katalah 1-year-old, fever, and then fitted, but otherwise well, not dehydrated and all that, sometimes we don't need to take blood. So tak semestinya setiap kali somebody comes in with febrile seizure, you need to take dia punya sugar lah, dia punya electrolytes lah, apa, no. So we try and keep it to a minimum. And always ask yourself, what are you going to do with the blood result? Is it going to help you with the management? So don't just take blood for the sake of it. Kadang-kadang somebody, contohnya, coming in with a respiratory infection. Okay, doctor, I will take blood to see whether it's bacterial or viral. It may be helpful, but sometimes your clinical punya judgment pun can be suggestive already. Somebody yang memang ada history of other family members down with cough and runny nose, and then now this child is ill with pneumonia, but fever is not that high, ada a bit of rash. It's going to be most likely a viral pneumonia rather than a bacterial pneumonia. And if it's not severe, sometimes you don't need to take blood. There's no such thing as routine blood test for any of the presenting complaints, except for a few cases lah, macam I cakap tadi. If you're worried about dengue, yes, there are screening tests that you can do, and you can also need to monitor dia punya blood counts. When you come to us, we will try and give you didactic lectures, and these are some of the topics that is often taught in these lectures. And these are topics that you have come across in medical school, kan? So it's just, you know, a revision, I suppose. But, you know, jaundice is a common problem. Respiratory distress of the newborn, what to do when babies are hypoglycemic, what sort of investigations you need to do. We do a lot of advocating as well in pediatrics, and we try and make mums breastfeed their children. Kita ada some years ago kita adakan hospital yang mesra ni kan, mesra apa? Mesra susu ibu kan, or something like that. So so that's important. And these are some of the other things, topics yang you will be taught lah. Again, all of this will be in the pediatric protocol. So I know you guys, some of you may have to wait lama kan sebelum dapat start. Semua belum start lagi kan? Sambil boring-boring tu, instead of checking your Facebook and WhatsApp, maybe you should go to the Paediatric Association and download some of the apa ni, and start reading. There's no harm in starting to read. Nanti at the end we will talk about, you know, if you do want to take up pediatric as a specialty, you can sometimes even do the exams while you're a houseman. So apa ni, it's good that you start reading lah. Okay. These are some of the teaching that we do at the bedside. You should try and see how the pediatrician examine a newborn. So the ballot scoring is a scoring system that we use to grade the child's maturity. So you should be familiar with that. What things we screen for at the newborn. You need to be familiar with what are the acute surgical emergencies. In neurology, cerebral palsy is a big problem, so you need to be familiar with that. In infectious disease, HIV, TB. TB is becoming very, very common. Almost every day, there'll be some patients in the ward being treated for, you know, either pulmonary TB ataupun extra pulmonary TB. Skin conditions are very common. Some are, you know, just mild and self-limiting. Others more serious. Other conditions yang you may not see in other postings is all the problems related with child abuse. Non-accidental injury. Non-accidental injury is common in babies. You will also need to learn the basic interpretation of ABGs, ECG, and in pediatrics, nanti bila you datang, you need to have a calculator, because you'll need to calculate. So instead of memorizing the doses of medication and how many pints of fluids you need to give to a patient, you need to calculate based on body weight. And then based also on the maturity. So for example, in newborns, the requirements on the first day is different from the requirement on the second day, and it's different from the requirement on the third day, and so on. So calculator is your other best friend. So you have two best friends in pediatric. One is your pediatric protocol, the other is a calculator. Okay. And hopefully during your time with us, you see how the more senior people communicate with children as well as their parents. So it's an important skill to pick up. And hopefully you'll get good examples. But as I mentioned, once you start your rotation nanti, you will see lah, there's a mix of people. Pilih yang baik lah, yang mana yang tak baik tu jangan ikut pula. Alright. You will all, I'm sure, have been told that you have your logbook to fill in, and for pediatrics, these are the things that we expect you to observe and then do. Ambil darah, neonates. You'll do a lot of. There'll be lots of opportunities to do that because, jaundice, checking bilirubin is very common. You'll need to do that. Pediatrics also, as I mentioned, the houseman nanti, especially when there are dengue outbreaks and all that, you are the ones, running around taking bloods and things like that. You need to be comfortable, or at least, for the simple ones, masukkan granular. You need to know how to take blood culture in an aseptic technique, and how to teach parents and children the use of inhalers, especially with the spacer device. All of you will have the opportunity to do this neonatal resuscitation. I think nowadays all hospitals try to do it because it's an important skill to learn in case you need to be on standby, ada emergency delivery dan sebagainya. Wherever possible, if there's a resuscitation going on, try and observe. Even if you can't be involved directly, see what the people are doing, how the whole resuscitation process is being done. Jangan run away and do other work pula. Nasogastric tube insertion is usually done by nurses, but you should try and see if you can, have a go. Macam mana nak ambil darah from the heel for dextrosticks. Oxygen therapy, application of some of the things that a lot of nurses do. So actually, you don't look down on nurses. In fact, you can learn a lot from our nurses in other allied healthcare. So you need to develop a good relationship with them and learn from them as well, especially the more senior nurses. More specialized things, so UVC, umbilical venous catheterization, you may get a chance doing it when you're in the neonatal unit. Lumbar puncture, exchange transfusion, most commonly for high jaundice. Chest tube insertion, you may or may not have the opportunity to do it, because most of the time we get more senior people to do it, but at least you should observe. Intraosseous line pun jarang, usually done in ED. But bladder catheterization and bone marrow aspiration, I think you should have opportunities to see it when you come to us. The house officer assessment tools, we do this workplace-based assessment, and that's in your logbook. You may find that so these assessments is not just to test you and see whether you pass or fail ke apa. It should be actually, orang kata, what's the word, membina you lah, to it's there so that as a guide, so that you can skill yourself with all these important skills. Anyway, and the same goes for some of these other assessment that we do during your stay with us. And these include your CBD, case-based discussion, mini CAX, and multi-source feedback. Here, I think one of the common problems I get with housemen is they come right at the end, the last week of their posting, and say, "Oh, doctor, I have to do a CBD case-based discussion with you." So you shouldn't leave it at the end. At least halfway through your posting, all of you will know already who your supervisors are. So approach them, introduce yourself. Sebab kadang-kadang, because there are many in a ward, your supervisor may not have an opportunity to see you at work. Because my case, for example, I'm doing a lot more neurology rather than general pediatrics. Tapi I still need to take many for these assessments. So if I don't know you, I will only assess you on that day, masa you present the case. And as you know, sometimes you may not perform on that day, ataupun you're too nervous ke apa ke kan. So it won't be a fair assessment. Similarly, kalau you memang tak guna punya houseman, tak gunalah. Kalau you lemah pun, tapi on the day you somehow shine, you'll get past your assessment. So it's not a very accurate punya thing. So you should introduce yourself and say, oh nanti at the end of this posting, you're going to be assessing me. So at least your supervisor tu tahulah you're there, and perhaps they can ask other specialists, other nurses in the ward about how you work, and that will help them to in their assessment. So jangan tunggu sampai hujung lah. Usually there'll be at least two assessors, the first and second assessment, and first assessment usually 1 or 2 months, usually the second month lah, and then one at the end. And if performance of any house officer is not satisfactory, we may need to do more assessments. And the whole idea is, after the first assessment too, you should see where your weaknesses are, where your problems are, and get help and try and improve before the end of the posting. If we've been through this, so case-based discussion, basically history taking, an examination, and discussion around the case. Mini CX ni more looking at how you examine, and then for multi-source feedback, it's reports from supervisors and your peers, and it's compulsory for all coming to pediatric posting to pass the neonatal resuscitation program. Kalau tak pass, ulang lagi. So again, yang ini pun don't wait until the end before you do the NRP. So yeah, a bit more about CPD, designed to assess clinical reasoning and decision making. Usually on a case yang you dah tengok and you clerk, there may be some discussion on ethical issues. We look at your note keeping, some decision making, but it's not. We're not expecting high level punya stuff. As I mentioned, at the end of the day, you want to see whether you've taken a reasonably good history, and that you don't make up history. So, you don't make up science, and you have a reasonably logical thinking lah, and you have some knowledge of the common conditions. So to get all that is not too hard. You just have to, and if you practice, especially kalau you baru nak first posting apa semua ni, right from the beginning tu you practice among yourself pun boleh, before you present to your MOs. Lepas you have seen a patient, just call your friend ke apa ke, and try and present. See whether your friend understands you lah. So if your friend boleh understand you, already that's you've achieved something. And one of the things that I like, and I always stress to not just housemen but also MOs, you try and tell somebody the story in such a way, bila lepas dengar cerita tu aja pun, even without examining, the listener already can have a mental picture of what's going on, and dia dah boleh come up with a few possible differential diagnoses or problems of what the apnea may have. So if you can do that, that's important. But it's not always easy, and it does need practice. but keep doing it, and inshallah you'll get there lah. And then, as I mentioned, but to do that, for you to come up with a reasonable list of differential diagnosis, you must have knowledge lah. You can tahu what the common conditions are, how they commonly present, and that's why I said, you know, the pediatric protocol should be you punya best friend. Another good way to learn ataupun to read, I sometimes don't like to read things yang are arranged by topics, macam apa tu, cardiovascular system, respiratory system, apa semua. Kadang-kadang sometimes a bit dry. So sometimes I prefer to, you boleh carilah dekat kedai buku ke library ke apa ke, yang where it's a problem based. So they give you a scenario instead of just explanation and things. So we give you a scenario because that makes you think. And you can find this banyak dekat online apa semua pun ada. And it's good practice. Sebab it makes you think, and then lepas you dah apa tu, you tengok apa dia punya solutions, and it's an opportunity also for you to read around the subject. So I think if you do that, inshallah the CBD won't be a problem lah. Yeah, so these are some examples that we sometimes ask. You know, when you order a test, what were you thinking of? How are the tests going to help you? So that's why bila you dah ada list of differential diagnosis, then you punya examination as well as investigation can be more targeted at ruling out all these other possible diagnoses. CEX, as I mentioned, is more macam short case, provide feedback on skills essential to the provision of good clinical care. It looks at acute care, clinical examination, your communication skills, and your clinical judgment. CEX usually is shorter, it's only 15 minutes. We see how you examine the patient, and it can be done anywhere, most commonly in the ward, but sometimes also in clinic, you'll have two. So you'll have, for the pediatric posting, you'll have two CBD and two CEX. And this is again the DOPS. It looks at your procedural skills, some communication skills, and how you deal with patients. So DOPS not just look at procedures, sometimes we also look at how you explain, contohnya, how to give advice to parents yang a child coming in with febrile fits. So you need to explain what febrile seizure is, and what to do and what not to do for the next episode, and what is the likelihood of the child having more seizures later on. That's common. Asthma education is another thing that's common. In the DOPS, we rate you against these areas, patient factors, hygiene, preparation, and your ability to perform the actual procedure itself. So in summary, the pediatric housemanship aim is to ensure that the end of the posting, the doctor is safe and can competently provide first-line care in primary and secondary settings. You'll never see, during that short posting, all the conditions that we see in pediatrics. That's not impossible, and that's not possible for medicine in general, because you will keep learning, and that's one of the beauties about medicine, because every now and again you will see new things, you will learn new things, and the patients your patients will be your best teachers, and you will learn from your mistakes. Hopefully you won't do too many mistakes, but that's unavoidable, and you should also learn from the successes of others. How, if there are things that people are doing well, you should try and emulate them. So we learn not just from mistakes, but also from successes of others. I've mentioned this. This is just go to the Malaysian Paediatric Protocol. It's downloadable. You can download on your smartphone ke, you punya tab ke apa ke. And you know, this is a cliche that patients are always right, but time and again, in my practice, in my own personal experience, this is true. Kadang-kadang, as I told you earlier, parents sometimes, when their children are ill, they become anxious. So macam-macam lah dia complain, kadang-kadang hidung tersumbat sikit pun dia nak complain apa semua. So sometimes we tend to apa orang kata be too reassuring sometimes. Kita ingat ini mak bapak ni je yang anxious kan. Kita kata don't worry, your child is okay ke apa ke. But actually whenever a parent selalu macam tu datang, if you're talking in the setting of in the ward for example, and these parents keep calling you, doktor tolong tengok anak saya ni okey ke tidak, anak saya ni okey ke tidak. That's usually a sign that something is not right. So always take parents punya concern seriously. And we have seen this too many times. Dok kata okay, and then nanti the child deteriorate. Right? So parents usually have this sense that when something is not right. So take the parents seriously and at least attend to them. If you don't know what's going on, get help. Jangan just reassure and let them be. So and it's always important to you want the parents to be on your side. Sama apa ni kalau ada penting bertelagah ni usually doesn't get anywhere. So finally, for those of you who are considering pediatrics as a specialty, some advice that I'd like to give. One, or any specialty, don't jump into your decision too quickly. Okay, because medicine is so wide. There's a lot of specialties around, and even if you don't want to specialize, pun tak apa. If you want to become a generalist, that's absolutely fine. We need a lot of good generalists as well. But if you do want to do any specialty, explore benda-benda lain dulu. Lainlah kalau masuk-masuk tu aja dah somehow ada macam ada electric connection ke apa ke terus nak buat, that's different. If that is the case, there are, for pediatrics, we now have 2 parallel pathways. You can either join the university and take up masters. It's usually a minimum service requirement that you need to do. I think it's something like 3-4 years, and you need to pass the entrance exam before you can enroll into one of the universities. And it's a four-year punya program. The advantage of the master's program ni is a bit more structured. Memang you'll get guaranteed rotation to all the various subspecialties in pediatrics, and you get an opportunity to do some research because you need to write a thesis at the end. The other pathway you can go to is the Royal College of Paediatrics and Child Health punya pathway. That's the UK punya exam. In some ways, it's easier because you can do it faster. Jadi yang I cakap ni daripada housemanship pun you can start, doing and all that. But the downside is, especially if you're not posted in a hospital where there's not a lot of specialties around, you may not get to do many of the pediatric subspecialty. And it can be quite expensive juga. The exams getting more and more expensive. But either way, it basically will boil down to you and your attitude lah. You can, if you have the right attitude, if you're really interested, I think dua-dua pun you boleh buat. And pediatrics is a good specialty. Why did I choose? How did I become a pediatrician? I pun tak ingat dah dulu. But I think it's because you will also experience this, I'm sure. Kadang-kadang you'll be influenced by the people you're working with, not just the specialty. And I remember when I did pediatrics, I had wonderful teachers around me, and the MOs and all that were very helpful. So, and then when I started working in the unit, I just somehow found it interesting, and everything was dipermudahkan lah nak buat pediatrics. I almost did orthopedics. As I did after my housemanship, I went to Kajang, did casualty, did some surgery, and did orthopedics. Orthopedics also I found was quite interesting. Dan dah hampir-hampir nak apply for masters in orthopedics. Tapi lepas tu did some pediatric posting, and I enjoyed it even more, and I've never changed since. So that's all I have to say about pediatrics and your pediatric housemanship punya posting. Ada apa-apa cepat sangat kan ni? Okey kot. Patut cakap sampai pukul sampai pukul 1. Ui. Oh tak apa, banyak lama Q&A ni. Any questions or houseman kena jaga NICU. You will be posted to NICU. You're not expected to look after the patient itself. Most of the time, you can play a supporting role, such as tolong pergi hantar ABG ni and check. Tolong ambil. Most of the time, you'll be put in the area where babies are recovering. So you won't be put in. You will rarely be put in the acute setting lah. But whenever there are procedures apa semua tu, most of the time you will be able to see, you will be able to witness. But pediatrics, I can tell you, at least in HKL, you will never be left alone. In fact, we can't leave you to do things alone. Even writing prescription pun should be supervised by your medical officers. If people are letting you do things yourself, something is not right. In the West, no, sorry, no, I shouldn't say West. In some countries, pediatrics is not a houseman rotation. Tak ada. I remember masa when I was in medical school pun, pediatrics is you do pediatrics after you've completed your housemanship. Cuma kita dekat sini buat. So don't worry about that you won't get enough support lah. Support will always be there, but you should ask for it. Ada soalan lain? Kalau yang new tu, I mean, because biasanya itu I cakap, and sometimes partly the fault of more senior doctors juga. Biasanya houseman ni akan disuruh buat benda-benda yang remeh-remeh, yang kan, and so blood taking and IV line setting are your routines. So some of you may struggle with this at the beginning, especially if you don't have a lot of exposure with and some of you may not like it lah, because you see this baby crying and you Yang ada yang hati keras sikit tu boleh tahan lah. But after a while you get used to it lah. You get used to it. But you shouldn't try too many times. You dah try 2 kali, 3 kali tak dapat line ke, just call your don't keep trying. Okay? The baby won't appreciate it, the parents won't appreciate it. You'll get lots of other opportunities to set line. So kalau your MO marah you, ini pun tak boleh buat, tak apa. Remember, patient always your priority. Orang nak marah you tak kisah. Kalau you tak kena marah hari ni, you akan kena marah besok. Kalau you buat benda betul pun, you may still get scolded. So you know, I hope you develop this internal resilience supaya you tak takut dimarahi. Patience. Just think about your patience, because you know you will be faced with all sorts of different nanti. Kalau you takut kan nanti, kalau you dekat peripheral nanti you takut nak refer dekat tertiary center. Takut specialist yang you call tu nanti tanya macam-macam lah, apalah, kata you punya management tak betul ke apa. Tak kisah. If you feel somebody needs referral, just refer. Okay? And you learn along the way lah. You learn along the way, and this will make you better doctors. So the procedures itself can be tricky. Some patients struggle with examination. Tak biasa nak examine children and babies because they're not like adults kan. You're very cooperative and you can examine them well. But again, it is something yang you will hopefully pick up lah. Macam dekat HKL, I'm not sure about other hospitals. Now there's a problem with, I wouldn't say problem lah, tapi ramai in a ward. So kadang-kadang one of the problems we see is you assume that somebody have done the work. Jadi in the end tak ada siapa tengok, tak ada siapa clerk the patient. So you know, when you are in the ward, try and see and examine patients yourself, and don't depend on, sebab biasanya kalau patients yang admitted, katalah through casualty ataupun through clinic, a more senior doctor would have seen and wrote their findings and their diagnosis. When you see the patient, try not to be apa orang kata, influenced sangat by what was written, you know, by the previous doctor. You examine, you take the history yourself. Jangan ikut history apa yang dah written tu. You take the history yourself, you examine yourself. It doesn't matter if you punya findings tu is different from the previous doctor, you punya MO ataupun the admitting doctor punya diagnosis. For all you know, you may be right. They may have missed important bits of information. They may have missed certain clinical signs that were not evident when first seen. Okay, so jangan ikut, and you know, trust your own history and your own examination findings. Baru you boleh learn better. Kalau macam you kata, oh, for example, ni dengar macam wheezing, but apa tu doktor tu kata dengar capitation, one of you will be right kan. Then you will learn, oh macam ni sebenarnya bunyi wheezing kan, ataupun macam ni sebenarnya macam ni. So jangan follow je. Try and make your own conclusion.